millions of Texans, there will be no more surprise medical bills. Governor Abbott has indicated he is going to sign a bill that eliminates surprise medical bills. But as investigative reporter Brian New explains, the bill alone won't protect everyone.
We've heard story after story from you over the years about how months after a trip to the hospital, you received an out-of-network medical bill that's often in the tens, even hundreds of thousands of dollars. State lawmakers have also heard your stories and say they now have a solution for some. When the bills came in the mail after her knee surgery, Susan Howe was expecting her insurance would cover most of the cost.
I made sure they were in network, the doctor was, and the surgery center.
But when she looked at the amount she owed,
I was stressed.
she couldn't believe her eyes.
And then I laughed and I thought, well, this couldn't be real. It was $33,107.
In other words, more than 10 times what she expected. Turns out, unbeknownst to Susan, the physician assistant who helped with her surgery was out of network. Her insurance would not cover the PA, so Susan was stuck with the bill.
It's eye-opening to know that you could go in and somebody can just send you a bill for anything, and if they make it out of network, they can ask whatever they want.
According to health economists, Texans are twice as likely to get an out-of-network surprise bill than patients in other states. And it's not because of a lack of due diligence by Texas patients. Most out-of-network doctor bills happen when a patient goes to an in-network hospital.
Senate Bill 1264 protects patients from getting surprise balance bills.
Led by Senator Kelly Hancock of North Richland Hills, Texas lawmakers passed a bill protecting unsuspecting patients from surprise medical bills. Under the new law, patients will be responsible for just their in-network charges, such as their copay. Any out-of-network dispute will be handled by insurers and healthcare providers.
The ayes have it. 1264 is passed its third reading.
The biggest thing it does is it brings everyone in, and it takes the patients out of the process.
Hancock says the bill will help patients with state-regulated insurance plans. The problem is most people don't have state-regulated plans. Only 1 in 5 Texans do.
We can only do so much because you do have federally regulated, those self-funded or ERISA plans, that we need the federal government to step up.
Like many people who work for a large employer, Susan has a self-insured health plan, so this new Texas law doesn't help her. But she says it does give her hope that someday all patients will be protected from bills that they never saw coming.
If I'd have known that, yes, you're going to get a huge other bill that you can't pay, I would never have done it, never.
So if you're not sure if your health plan is regulated by the state, look for the Texas Department of Insurance logo on your insurance card or simply ask your Human Resource Department. There is legislation in the works at the federal level that would do away with surprise medical bills for everyone. President Trump is urging lawmakers to get something passed. We'll keep you updated. With the I-Team, Brian New, CBS 11 News.
Brian, we appreciate the insight. If you have any tips or questions for Brian or the team, you can contact him anytime. Always available. I-Team at ktvt.com.